Ladies and gentlemen, JetBlue Airways welcomes you to Daytona Beach.
So I'm Joy Chin.
Yes.
I've been a nurse for 27 years.
Okay.
I graduated from Loyola University in Chicago. And I've worked on med-surg floors from special procedures to, which special procedures is basically for arteriograms. And I've gone into a pre-op where I've worked with getting patients ready for surgery in the peri-operative area. And actually now I'm still in the peri-operative area, but I'm working in the pre-admission testing, which is basically before pre-op. So I make sure patients' paperwork are in order, make sure patients are not canceled on the day of surgery. So if they need any kind of clearance, cardiac clearance, that's where I come in and make sure all that is taken care of. Now, usually when my patients, when they come in, we have a little office, so which is kind of nice because you get to sit down with the patient face to face. Patients come in, they're having their procedure. First of all, you want to make sure the patients know why they're even there. That's important. I always make sure the patients know, why are you having this surgery? Did you get a second opinion? Did your doctor explain the procedure to you when you first met him or her? It's important for making sure that the doctor is talking to the patient, not a medical assistant or even a nurse practitioner or a physician assistant shouldn't be explaining the procedure to the patient the first time. The surgeon should be the one talking to the patient because they're the one doing the procedure. So I make sure the patient is aware of what's going on. We ask questions about like after surgery. Where are you recovering? If you're having a joint replacement, are you going to have rehab? Are you going to have someone come into the house for rehabilitation? That's important. You want to find out if the patient lives alone. If the patient lives alone, and if they're going home that same day, they can't go home to by themselves. That needs to be told to the doctor. Did you arrange for the patient to have like a 23-hour observation? Is the patient going to have a family member that's flying out from out of state? We need to take care of that firsthand. Most of the time, the patients are not prepared because when they're in the doctor's office, there's a lot of time restraint. Patients are like kind of, sorry to say to use this, but like an assembly line. They're just basically in the office, and the medical assistant might come in and talk to the patient and just say, okay, you're going to have surgery. Here's your appointment. You need to go to your PAT appointment, which is pre-admission testing, and they'll fill you in. And when the patient comes, the patient is like, well, can you explain this procedure to me? And we're like, no, the surgeon is the one doing the cut-in. We're not doing the procedure. We're just making sure that you are cleared and no hiccups is going to occur on the day of surgery. So usually the patient has to be like redirected back to the surgeon's office, or we are actually being advocate for the patient and call in the patient doctor and said, Miss Smith is still not sure why she's having this procedure. She doesn't know if what type of, are you going to make an incision or is it going to be laparoscopic? What are you doing? This patient needs additional teaching. So either we have to send the patient back to the office. Most of the time they're very close. If the patient goes, sometimes we call a shuttle from the hospital to take the patient back to the doctor's office. And just things like that. But it's always, we have to get to the core of it. Do you know what you're having? Do you know what's happening? And the patient would be, well, the doctor says I need this surgery, but what about you? First, we need to know, what do you think? Do you think you need surgery? Do you think you need this type of surgery? Did you get a second opinion? So we have to talk to our patient. We have to build a rapport. We have to make sure the patient feels comfortable. You have to provide like a safe and a safe and secure, non-judgmental environment for the patient. So the patient feels free to speak. And when you do that, you'll hear a lot of stuff that you didn't even ask, but you'll find out. You'll find out that Miss Smith lost her husband a month ago, but no one knew. Then she lost her insurance. So now she's not even taking her medication because she doesn't have insurance to pay for it. So, it's not that the patient is being non-compliant on purpose. The patient is just not being helped, like finding out, getting to the core and listening to the patient. So majority of the time, majority of nurses, when we come into our profession, we're coming in with this positive, idealistic, say, oh, we're going to do good for our patient. We want to make an impact, a positive impact. We want to make sure our patient, just making a difference in their life. So you get on the unit, you get on the floor, and you have barriers such as time restraint, time constraint. We're always pressed for time. The nurses ratio, patient ratio is very high. You have 6 patients to a nurse. I haven't been on the floors for a while, but this is what's happening now that they're saying that it's very high. And then you have the clinical situations with the excessive charting, the double charting. You're putting the same information in different places. So, if we can eliminate some of the charting, if you chart it one time, it's because we do say if it's not documented, it's not done. But if it's documented one time, why do we need to have it documented in 3 different places? So the documentation, the high patient-nurse ratio, and press for time, those are some of the barriers that I can think of. I'm sure there are more. Patient-centered care is achievable. It might be difficult, but it is attainable. I mean, you as the individual, because it takes one person, it takes that one pedal to you have to go in and say, okay, this is the reason I came into this business, to make a difference in my patient's life. So I'm going here. I'm going to set, even if I set goals to meet 2 patients' needs that day, it's better than meeting none. If I go on and say, okay, Ms. Smith, I am going to go in a room and I'm going to start with making eye contact. I am going to touch my patient. I am not going in there with the computer and talk to the computer while I'm talking to my patient. I am going to listen to what my patient is saying. I am going to turn to her, he or she, and say, I hear you. I hear you. I feel your pain. How are you feeling this morning? How are you coping? Is there anything I can do with, that can make your visit much bearable, much more pleasant? So it's just how we attack our day, how we come in and say, I know all this is happening around me, but this is what I am going to do as an individual.
So what are some other ways that to determine social determinants of health?
There are quite a few. There are different ways of determining patients, like finding out where the patient lives, how is the patient living condition at home? Is the patient having difficulty providing funds to obtain their medication? How about food? Are they able to provide for themselves? Rent. Do they have to use the money that they would be buying their medication to buy food and pay their rent? So this is when we as nurses have to, the first thing, this is how you find out these things, by communicating with your patient and finding out where the need is lacking. So social service, case management at work, I usually try to always get a consult. So the patient, and not by discharge, we try to get that ahead of time, establish that in the middle of the hospitalization, so the patient, they can figure out, now this patient is going to need help, or the patient needs help now. Right now they're having difficulty trying to find funds to get to just buy their medication. There's just their basic needs. Do they have any family member? Do they have a neighbor that can help? We just need to facilitate just the line between where this patient is coming from and meet this patient at their level, at their preference. We need to treat the patient to their preference of how they can adapt to the healthcare by what we're providing for them. Not like, okay, you're supposed to be meeting us here at this level, so I'm sorry, we can't deal with you. If that's not what we're supposed to be doing. We're supposed to be finding out, how can we help you as healthcare manager? How can we decide what is going to be beneficial to you? Getting the patient involved in their care decision making. Can you share some of how you would like, just let us know, how can we take care of you and what's going to help in your condition? finding out where the patient is. So when the patient comes in, and because sometimes patients come in and they already have this, it's almost like they have a little wall or front up and said, okay, I'm coming in and this is what I'm about to do, and you're the nurse, I'm the patient, and it's almost like they're saying, well, you think I don't know about myself, but I do. So you as a nurse is basically going to say, Miss Smith, tell me about yourself. The patient does not want you in their face, like telling them this is what you need to do. This is how it's going to be. What works for you? Do you prefer to have your treatment in the middle of the day because you tend to seem like you woke up, you go to bed a little late? So can we work around that? How can we work to make everything goes, smoothly for you? So do you prefer to go to physical therapy midday because your arthritis acts up during the morning? Or, the nurse should be talking with the physical therapist. What time are you coming to tend to Miss Smith? Should we medicate her 30 to 45 minutes before she goes to physical therapy? So if the patient knows that you're willing to work with them and meet them instead of non-judgmental environment, that's basically, you have to provide that for them. I try to encourage my patient to ask a lot of questions, like in the department that I'm in now with, getting patients ready for surgery. I encourage a lot of questions asked because patients tend to just say, oh, well, the doctor says this is how it's supposed to be, so that's it. So I say, question the doctor. Don't be afraid to question the doctor. If you don't feel comfortable within yourself, ask questions about, well, is this the only choice I have? Do I have a second choice, or do I have to have this surgery now? Can it be delayed? Can I have conservative therapy before actually going into surgery? So if they ask these questions of the doctor, they will get answered, but they will meet you the way you approach them. Whatever information you ask, that's the amount they're going to give you. So just have your list. I say bring your list with you at the doctor's office and check them off as they're answered. And don't leave that office. Do not get up out of that chair until all your questions are answered. And I try to empower my patient and say, we're not trying to cripple you, because when you leave here and you go out back to your pre-existing hospitalization state, we're not there with you. So I want you to be equipped with this tool. So when you come in encounter with any more healthcare services, you're able to interact and feel at ease with what you have on board. New nurses, I always tell new nurses, do not come on the floor. When you come into work, I tell you, do not come and be influenced by the nurses that have been there a long time and trying to discourage you and telling you, oh, that is not going to work. Oh, good luck. Do your thing. You went to nursing school on your own. You sacrificed a lot of things to get where you are. And now it's your time to shine. So your fresh face, your fresh blood, everything is fresh about you. So you want to go in and you want to shine. You want to let the patient know that you're there for them. Do not be influenced by older nurses. And I'm one of them, but I do encourage young nurses. I say go there and just, be there for your patient. Just do not be discouraged. For the healthcare administration, I think most of the time they spend a lot of money in handouts, paper, just like reading materials for patients. Now, we know we give a lot, especially with my PAT appointments. Patients come in, we have a bunch of paperwork for patients to go home and read. If you do surveys, patient tells you that they learn better by verbal. Verbal instructions are always best for patient. So when we're handing them out all this paperwork with all the instructions, patient go home and they just file it away. They don't read it. So instead of spending all this money, and it's a lot of paper, books that are costing a lot of money, I think they should take those money and they should take those funds and put it into hiring more clinicians, like more nurses, more techs, And that at least you'll have time to spend more time with the patient, teaching the patient, and actually getting through without being rushed and being under any time constraint. So I think that's one of the big things I think that the administration can focus on. Just spending more money on hiring more employees, more clinicians.
So I came across your content via Instagram. You're not only doing your profession to earn a living, but you're also taking that time out of your day to spread your message via social media. Why did you start doing that?
Oh, okay. That's interesting because, as I said, I've been a nurse for 27 years, and I have two sons, Brandon and Jordan. And, I would come home and I would say, oh my gosh, I can't believe, the things these patients are saying that they're not being taught. Patients who have been diabetic for how many years, and when they come across me, they're like, oh my gosh, and no one has ever told me this. I said, what? You've been diabetic for 10 years and no one has told you that you have to eat within 30 minutes after taking your diabetic medicine? They're like, no. And I said, well, where is the breakdown? There's patients are not getting any kind of teaching. So my boys are like, Mom, you need to do something, need to say something. And they're younger, so they're in this era with the Instagram and the Facebook. And I'm like, well, I do my part. I'm at work and I make sure all the patients that come across my path, they are being taught what they need to be taught. So they said, no, you got to do more. You need to send out the message to the world. And I said, okay, all right. And they are of this century. So they said, why don't you just start like a little blog, Instagram? I said, oh my gosh, a blog? No. So I said, okay. One day I said, all right, I'm going to try. So I just went on and I said, you know what? I'm just going to give patients daily tips. Okay. So I start out usually in the morning. I go on and I just say like, this is Nurse Joy, patient advocate. So I would say, for instance, if you're going into surgery, you should hydrate the night before. Hydration is always good. It helps with your veins. It helps with post-op nausea. It helps just going into surgery with your tissues all moist. And I'll give other tips about after surgery. When you're in the recovery area, make sure your family member is by your bedside listening to instructions, because anesthesia takes 12 to 24 hours to leave your system, and it's important that your family member hear firsthand what's going to happen, how to take care of you while you're at home. And make sure if you're feeling any discomfort or any pain, do not leave until that is rectified. Well, for me and hopefully other healthcare workers, how they can be more pro-patient, getting your patient engaged, talking with your patient, informing, making your patient well-informed. I usually use a technique called the read back. If I give return demonstration, whatever instructions I'll give my patient, I would have them return and say, what did you hear me say? Like if I give them instructions of how to use a scrub that they're supposed to use at home, an antimicrobial scrub, how did you hear me describe this tell you the instruction? Tell me what you heard. And sometimes when they tell you back, they heard half of the instructions. So this is, just making sure that your patient are well informed. They are engage your patient in decision making, make them a part of whatever that entails about their healthcare. Make sure they know and understand fully what it's all about. If we have patients that are from different, diverse background, different cultures, we need to, as nurses, come with a mindset that we're going to embrace differences. We should not come with any judgment or any preconceived notion about how one set of people should be acting or behaving. We should actually learn how to deal with the patients, how they deal with their ailments. Some culture, when they deal with pain differently, they might be subtle. They don't make any sounds, they talk. But you as a nurse have to be trained enough to know, is this patient in pain, by looking at their physical, you're touching the patient, you're looking at their physical cues. Are they turned away from you? Are they in a fetal position? Are they clenching a body part? You have to know how to detect about their pain, because some people are quiet with their pain, some people are loud with their pain. Also, if patient has English as their second language, making sure that there is a language line or a certified nurse who speaks that language is available to talk to the patient. So we're making sure that the patient needs are being met, not just like saying, oh, do you understand? The patient's basically going to be just, yes, 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 and the patient did not understand a word you said. So it's vital to get the patient the resources that is needed. Want to make sure information is clear as crystal, not clear as mud. So very important. Patient needs to be understood. We need to be responsible to implement that. So my Instagram handle is joy_patient advocate. And currently I'm in the process of writing a book. It's called Blockchain Technology, Nurses and Your Health. It's in the editing position right now. So as soon as it comes out, I will have it on Amazon. It also, it talks about the new blockchain that is eventually, I think, is going to be a part of our healthcare system, and about how to get patients ready for surgery. So between my son, Brandon Chin, who is an author, and me, we're going to be getting this book out to the public. It's geared toward the healthcare professionals and the the blockchain that is supposed to be coming in effect. It's coming. It's here.